Hi, I'm Jessica Hewitt. I work for Clear Passage Physical Therapy in the scheduling department. I've been here for 5 years. When you call in to schedule an appointment or ask for more information about what we do, I am the person that you would get to speak with. I had dealt with infertility for 8 years after a miscarriage in 2012. I had to have a D&C done. My body just wouldn't pass it. So the doctor had told me that I was able to go home and try again. Was never able to conceive again after that. So I started working here in 2018. Didn't really plan on going through the treatment just because I was older in age and really didn't want to go through the heartbreak anymore of going through, the process of trying. So gave up on that and just really wanted to help other women to be able to conceive. So I started working here with all the infertility women and just really to join them on their journey or help them to conceive and, fulfill their dreams of being a parent was, really important to me. So it was really fulfilling. So again, I didn't plan on going through the treatment, but we ended up hiring a new therapist here in Gainesville. And before she could actually do like her treatments on patients, she needed to learn on a live person. So they asked me if I'd be willing to donate my body for that cause, which I did, and it was the best thing that I've ever done because I actually suffered from a lot of lower back pain and some headaches. And so if I wasn't able to conceive, which I even let them know I wasn't really trying at this point, I didn't want to get my hopes up. But if they could help me with my other issues, I would really be grateful for that. So we ended up doing the treatment the first day. They were able to tell me that both my tubes were blocked. And then on the second day, they were able to do the internal work and tell me that they couldn't find my cervix. So, we had to get a little deeper in there, and they were able to tell me that my cervix was actually being pulled posterior. It was adhered to my bladder and my tailbone. So my lower back pain that I was going through was actually because of, the adhesions, and it was part of the infertility as a whole. So with my tailbone being pulled forward and the lower back pain, that was actually pulling downward on the spine, causing the headache. So all of it was actually all connected. So that's kind of how treatment went for me. And then on the third day, they were able to tell me that based off my cervical mucus that I was actually ovulating and I should go home and try. And I did conceive the week of treatment. So I found out the following month that I was pregnant. And my son Hayden actually just turned 2 years old last month. I was a little nervous at first when they first asked me. I didn't really know what to expect out of treatment. So I was a bit nervous in the beginning, but got very comfortable very quickly, and especially because I work with these girls. But they were very professional the whole time, and it was very comfortable. I did end up having an emotional release. I wasn't expecting that at all. They were working on me, and the next thing I know, I was just crying, just letting everything out. And I was actually told that that's very normal in situations like this. You store all of your emotions and internally, and so having an emotional release is very common. For me personally, the treatment overall was not painful. I did experience some slight bruising. I was pretty sore after a few days, but it was nothing that I needed to take pain medication or anything like that for. The therapist will ask you on a scale of 1 to 10, how are you feeling? What is your pain tolerance? And so they'll work with you on what you're feeling. It never has to be too painful for it to work. So if for some reason, you're experiencing a lot of pain, speak up, let the therapist know they can ease up. But for me personally, it wasn't overly horrible. You can feel like a pinch or like a pulling, like kind of like a tenderness. And then as soon as they start to manipulate and start breaking things down, it kind of just seems to melt away. One of the main questions I get is this like a PAP? And it's not. So we don't have you up in stirrups the whole time. What you'll do is you'll be on the massage table and you'll be covered with a sheet. The therapist will be standing off to the side of you most times. And they'll insert, 2 fingers or 1 finger or whatever they have to do. Everything is sanitized and gloved, obviously, but they'll go in and they're just going to feel for adhesions, but they're not down there looking the whole time. You are covered, so it's very comfortable, and it's very different than a PAP. So before you come for treatment, there is no prep work that you have to do. You don't need to change your diet or anything like that. However, when you're here for treatment, the therapist will direct you on, walking after your treatment and drinking plenty of water to flush out any toxins. I am so grateful for Clear Passage Physical Therapy. Without them, I wouldn't have my miracle baby Hayden. And to celebrate, Hayden being the 1,000th baby born, we are giving away $500 off your treatment for the month of August. If you're interested in scheduling with us, please give us a call at the number below.